Greetings. This is Dr. Carl Golnick, Chair for Education of the Ophthalmology Foundation, and a very short session here on teaching and assessing in the clinic, something all ophthalmic educators and probably all medical educators do during their careers. So my objectives are to describe the micro skills of teaching in the clinic and then provide formative feedback using appropriate assessment methods, all in 5 minutes or less. So there are a lot of skills that can be learned in the clinic by residents. All of these, history taking, physical exam, et cetera, these are, I think, things that we think of routinely, but there are a lot of other things that can be learned too. Patient education, how information is handled, communication, professionalism, resource allocation, et cetera. So how do we do this? Well, I still think this paper, published now more than 30 years ago, has got very helpful guidelines. So let's look at the 1-minute preceptor. Number one, get a verbal commitment from the learner to an aspect of the case. So that simply means ask some questions. What do you think is going on with this patient? What other diagnoses would you consider in this setting? So get a commitment. 2, explore the basis. Don't just think, oh, they're probably right. Make sure that they understand why they're right. So what factors in the history and physical support your diagnosis? Or why would you choose that particular medication? Don't let them just guess and be right. 3, teach general rules. You're in a busy clinic. You don't have much time. 1 or 2 points about a patient will solidify things in the student's memory. Cataract surgery is indicated when visual function no longer meets the patient needs, or these are the criteria for ordering ancillary tests in uveitis. And then reinforce what was done right, okay? This is not all about what they could improve, but maybe they're doing some things very well. So your diagnosis of glaucoma was well supported by your history and physical. Reinforce the things they're doing well. You want them to keep doing those. And of course, you're going to correct mistakes. Well, you didn't include the family history. Now, how do we do this? Give this good feedback. One method is to more objectively assess their performance in the clinic. And that's the basis and really the goal of this ICO ophthalmic clinical evaluation exercise, which was published a couple of years ago now. And this is a form that looks long. It's not really. It's simply what you observe during a resident-patient interaction. You can see on the left side various parts of the interview. They're taking the history, and then a rubric here that allows you to simply circle the behavior you saw. What did you see? And this makes the evaluation a bit more objective. So the idea is you circle what you see, and then you immediately give feedback to the resident after the observed interaction. And this includes interview skills, the examination, in this case, of course, the eye examination, and it tells you what does it mean to be competent or a beginner or a novice. And you simply circle what you see and let the resident know. Even interpersonal and communication skills can be assessed. And finally, the case presentation. How does the resident present the case that you just watched? How do they present it to you? I've heard some very interesting interpretations of things. And this gives you a way to know, does the resident really know, and can they synthesize what they're doing? So in summary, you want to define some learning objectives at the beginning. You want to provide constructive feedback, and that means assess objectively, promote a supportive learning environment, and I repeat, assess objectively, provide that good formative feedback that will help your student become a better history taker and examiner in the clinic. And to learn more about this, you can look at our Teaching and Assessing in the Clinic Module 4 of our Teaching Skills series. This QR code will take you to that series. You do have to register. It is free, and you can get continuing medical education credits if you desire. Thank you for your attention.